Lovely to see you all. So first and foremost, I must acknowledge that this is a very emotional moment for me, and also one that really fills me with a lot of hope. Been speaking to a few people here about why we need these spaces and these gatherings, and why we need more of them to make sense of the chaos in the world and to also feel motivated and develop a hope. The emotionality bit is that exactly 10 years ago, to this day, we were in this church in Glasgow. We didn't know, in Edinburgh, sorry. And we were working on the the first People's Health Manifesto then. And right after we had a policy dialogue with our manifesto and members of political parties. Maybe over drinks later this evening, we can talk about what the stance of different political parties were at that time. But it was really an exciting moment for us all to create the first health manifesto and think about a new accountability mechanism that movements could draw on. So there are just some pictures, and you'll see similar sort of flip charts with different notes health in all public services and all policies. And we continue with this. The only reason for all this was just to say, as Neil mentioned, I'm an academic activist, and anyone working in public health space or global health and health inequality space has to be an activist, because we cannot realize the normative goals around health for all and health equity without the advocacy and activism that needs. So just I was asked to share a bit about solidarity building and actioning change for health justice. I'm going to draw on these three. I've been asked to plug in our book that we have recently launched. It's Advancing Health Rights and Tackling Inequalities, Interrogating Community Development and Participatory Praxis. And this is really this is something Neil, myself, and Abhijit Das, another PHM India member, has written together. And it really brings in a lot of our experiences in Scotland, in the UK, and elsewhere in the People's Health Movement. So it's really something we wanted to develop, trying to challenge the assumption that, and also acknowledging the big gap in writings and theory about social participation, where the theorizing happens not in the spaces where activism happens. And what we wanted to do was make sure that advocates and activists from these multiple experiences of organizing are writing those books and sharing these learnings. So this is actually, and what is also presented in the book, and what I wanted to highlight here was that it's really over the years of our advocacy and activism experiences, we've had the opportunity to also transfer promising ideas of organizing and accountability through, for example, holding the first public hearing on the right to health, specifically on mental health in Scotland. And this public hearing and citizens' tribunal model has its roots in the Global South practice of activism, which we were able to adapt to a very different context with new, interesting and important learnings. So the book really, and what I'm going to talk about, is a summation of all these different experiences of being part of different movements. I'm not going to repeat and go much into this here, because Tony has already alluded to the polycrisis that we are witnessing today. And it's important when we talk about organizing and mobilization, we also acknowledge that organizing in a polycrisis world has to be different from how we've been organizing until now. Of course, polycrisis is this concept which is now even acknowledged by the World Economic Forum in its 2014 report, and which is what I'm highlighting here, which talked about the global risks. And the idea that polycrisis arises when very interconnected systems of so natural ecosystems or health, welfare, security, economic systems um, uh, are interacting and to produce harms that are irreversible. So the idea that any shift in one particular ecosystem is connected to the other and produces and has an impact that is really often irreversible. So, and in the World Economic Forum report, it talked about global risk, presented a very grim picture about the ongoing warfare, vulnerability due to conflict from Sudan to Gaza, talks about record-breaking extreme weather conditions and the climate crisis that we're seeing, as well as the social discontent that is emerging from this. So the longer-term outlook for these developments, the report highlights, could bring global shocks and setbacks that will be difficult to intervene on. So now we are already seeing those setbacks, and I think Tony's slide was very clearly listing down all these setbacks. However, so in this, these are images that I'll be using from the book. We had a fantastic person to help us with these infographics. So really, it was talking about what kinds of existing systems are in crisis and how they are interconnected, how they're impacting on people and broadly societies. Right now, one element of the polycrisis, which is clearly what I see is as the neglected dimensions of polycrisis, is one of the ideational crises that we are witnessing today, right? Which is the hegemonic ideas and discourses that are shaping all our policies. And in the book, we specifically highlight neoliberalism and neoliberal economic thought, as well as coloniality. So the idea that all these systems and the kind of crises that they are creating are resulting in the loss of social, economic, political power among communities, have created a growing disenfranchisement of people and also societies. So societies themselves are becoming very atomized. This image really talks, it's from a 7-year-old article, I think, in Guardian, which talked about neoliberalism creating loneliness, and that's what's wrenching society apart. And we saw that quite starkly during the COVID crisis and the mental health crisis that has shaped since. So we're seeing the landscape in which we are advocating for health rights changing dramatically. You're also seeing this is a central premise in this book, that what neoliberalism and colonization and neocolonialism has really unleashed is, of course, unrivaled economic growth and wealth creation, but it has also resulted in unprecedented human suffering and an emotional, psychosocial crisis, and the kind of atomization that I highlight here. There is also a shrinking space for resistance. You're seeing civil societies often and activism often being presented or pitted against one demand being pitted against another, right? And the whole picture of inequalities and the aid cuts is an outcome of that crisis of oppression that we are we are seeing at the global scale. That the aid to improve or strengthen systems which are completely ravaged by war and conflict in the global south are being pitted against rebuilding societies and care economies in the global north. So what you're seeing is really a shrinking space for resistance, a fragmented space for resistance, and the space for resistance itself being completely captured by neoliberalism. The other aspect that we see in how this discourse is maintained is by keeping the effects and legacies of colonialism unquestioned and uninterrogated. So what can we do about this? And we emphasize in the book that in order to counter this loss of social, political, and economic power, we need a stronger countervailing power and countervailing power of people from below. And this, to me, is the central thesis of what we're trying to say in the book, while making an argument about what are those pathways for action and justice. But the idea that this, but also important to acknowledge, and I think this is not a new idea. Everyone here believes that we need a countervailing power from below. I think what is also important to highlight in this context is that development of this countervailing power needs a certain minimum opportunity and capacities, right? And that opportunities and capacities for organizing, we're seeing that shift, that we do not have that capacity to organize. What it also needs is an acknowledgement that communities or societies and power to people would not help us address the inequalities within those communities, right? So it is not a level playing field, and power to people would also need some understanding of which people are drawing on power or occupying the spaces and who are being left behind. Our attempts to address and bring power to people also exacerbating the inequalities and the oppressions in the communities that we are working in. So I think these are the sort of core ideas that I want to really highlight about. So in the book, we talk about, of course, revisit some of the ideas of what is a community. Are we talking about communities of identity, of resources, of geographies, of shared concerns and conditions? So really problematizing who a community is, what is participation, and the very different meanings and applications of this concept of social participation that we see today. But it also then identifies four sort of key pathways for health justice, which is really about tackling health inequalities and engaging with communities at the margins, and how those voices that are most affected need to be brought to the center of any of our organizing efforts. The second is really the role of social movements like People's Health Movement, like MedAct, and several other organizations and networks that are here, in addressing the political, social, environmental, but also the commercial determinants of health. So no longer a human rights-based approach can focus on holding states to account, but we are dealing with a very corrupt nexus of states and markets that need to be at the heart of any advocacy efforts. And I mean, your whole discussion around public pharmas yesterday is really attempting to do that. Then we have the third is strengthening systems of accountability and making services more responsive. And here, the idea of accountability mechanism is really giving power to people, but also new ways in which one can hold not just member states, but also the corporation, the corporate sector and the health harming industries to account. And finally, the aspect of how do we organize communities, how do we organize people and sustain actions. Now that's where I feel one of our biggest challenges. So it is really heartening for me to see how a very modest efforts starting in 2012 around the austerity and how austerity agenda was being played out, and us wanting to come together to resist that has led to the sustaining of movement in Scotland and beyond. So how do we work across those different areas and interests and work on these? So now the question really is about how do we build this countervailing power? And as I said earlier, because the landscape has changed so much, it is really important. I might just skip this. Yeah, it is really important to acknowledge and agree on a different politics of activism and organizing. And I think as part of movements, it's our responsibility to reflect on how we have been organizing. Who are we speaking to? Are we speaking to people, already converted people? How are we connecting with the local the issues and struggles and the global injustice struggles that we are fighting across the board? And I think being humble about our failings and about what we have not managed to do. So really the idea of having a different politics of activism, the need for interrogating and organizing across single axes of oppression, going beyond identity politics and talking about distribution and redistribution of resources as well as representation. And also firm location of this organizing in intersectional justice and global solidarity. I think the 2 points that I really want to emphasize here is about building what an intersectional justice practice looks like and how we build that. So firstly, the whole radical shifts in our approach to resistance and our actions of solidarity really require us to think about that polycrisis, the systems that are connected, and how single issue struggles need to be only an entry point to address and to tackle the political, economic, and environmental determinants of health, and the kinds of narratives that are being built about the oppression, the race around oppressions, and the competing oppressions. I think this is one infographic actually from a People's Health Assembly, IPHU, the People's Health University talk that I and Kiara had done, and somebody brought this really into a very smart infographic. This is not the talent I have, but the idea that it's really important about if we are looking into an essential medicine or access to essential medicine, is how do we link up with where we are locally embedded with our communities, and how those issues about trade, about IP issues, trade wars that we are seeing today is impacting on those day-to-day lives, and connecting with people in the community of geography, while also bringing people who are connected with us to community of shared concerns. And I think that's, for me, has been a learning experience and key to organizing. The other important point that I want to raise is that in doing this, then we also then need to think about solidarity among different groups, right? It would be including communities in the North and the South, or the minority and majority world, as you referred to it, between diverse struggles and campaigns, and those experiencing these multiple injustices. For example, the patients organizing around health rights and violations, coming together with the health professionals demanding improved conditions of work and pay, and activists addressing backlash and threats to civil liberties, need to come together and be standing together around the health rights justice movements. We also then need solidarity between those who are suffering these acute injustices and those who are empathetic but not directly affected. And most crucially, and I think this is really something that I want to emphasize, is in order to do all this, it is important to deepen some of these effective links between these groups to combat the discussions that we are seeing and fostering constructive social change. I'm just going to highlight two important ideas around the solidarity building. So clearly, embedding organizing has to be a founding principle of our approach to health justice. But what this really requires is developing those long-term sustainable relationships of solidarity with these communities, organizing with communities rather than for them. And I think a lot of our advocacy efforts tend to speak for people and communities, not with communities. And finally, building communities of trust, of hope, and communities of solidarity. Now, it was the hardest part of writing the chapter was the conclusion chapter, because it was being written at times where there were equal number of protesters for masks and anti-masks, for vaccines and anti-vaccines, and equal number of people who were standing for immigrants' rights, and those who were attacking the asylum-seeking hostels. So I think we and that to us is one of the biggest challenge that we confront in building sustainable movements. I feel I just want to highlight, just to please very quickly go through the case for organizing in Scotland, and just share some of the history, which I think Mark has done a brilliant job already. But I do want to highlight that when we started this work, it was just acknowledging and trying to understand what the impacts of austerity is. And just with a very, very small grant, we were able to roll out a whole participatory action research program, which was done across Scotland to document the effects of austerity. And that was the precursor to building a movement in Scotland, right? There are some sort of images and timelines which we have also written about, not as much, but also there we've contributed the story of the Scotland in the resource book that PHM did on building social movements. So there are case studies that are written there. But these are we utilize that space to bring in communities to through several different forums, from community festivals, the human rights festivals, to including using the Edinburgh Fringe for holding discussions on some of the key challenges that we were experiencing. Hastings had the People's Health Manifesto, and then utilized this as a strong accountability tool, including doing presentations on health inequalities for different political parties. So at the time, I recall a Green Party literally ran with our manifesto and adopted it to theirs. SNP picked up a few of those components, and quite a few of these events were responsible. So this is, as you can see, one of the SNP members, and that was a very interesting exchange that we had. There's some representation from Green Party and Labour Party afterwards, not at the event. But a number of different ways we engaged with different stakeholders, and led to the first public hearing, which really fascinatingly combined. This is actually, this is 2012, 2014, I think, is the Musselburgh, the Scottish Health Assembly we had in Musselburgh, where the Forum Theatre group was bringing in people to think a bit about what health in an independent Scotland should look like. And so we very opportunistically also utilize these political moments around referendum to talk about how do you build health and build a healthy and just Scotland in an independent Scotland. Of course, the results in referendum went the other way. But there was a massive momentum which we grew on at the time to develop the manifesto. Mark has already talked about this, but in this public hearing, we were bringing in the communities who were involved in the participatory action research program, and them testifying their experiences to a panel which had member representation from the Human Rights Commission and from the Scottish Government. So we had people who were part of the research and part of the study also doing a forum theatre, and besides the testimonial evidence, besides the empirical evidence that we had collected from a range of different organizations. And I know Kingsway Health and Wellbeing is here. They have been part of this journey from the very early stages of the development. We were all pulling in reports. We were developing reports from the evidence that had been collected from a number of different organizations, but then also using this theatre space and to talk about the critical issues. In addition, I mean, I think while we engage locally, and it's really important that we do not forget that we do need this broader politics and alliance around redistribution mechanisms, resetting the global order, to talk about the aid cuts that are currently happening, or think about regulating state corporation nexus and corporate accountability. There are a number of different sort of organizations who are at the forefront of doing this. So finally, one bit that I want to come back again is all of this needs to happen with communities at the heart and center, or we risk more divisive, more polarized communities and societies, and really the efforts not meeting the end goal of solidarity building. This is one example from a recent work that I've done with other people and organizations in Essex, mapping health inequalities, in particularly mental health, and how that has led to the conception of the social clinic model for tackling mental health and for thinking about integrated mental health care. Sorry, so I'll just end there. Thank you for listening, and what's the
Thank you. You covered a lot of ground and lots of inspiring ideas there. We've got just a few minutes for questions. If anybody has any questions they'd like to ask Anuj or points they'd like to build on. Yeah. We want to